total population of Indonesia in 2020 was projected to reach 270.2 million. According to gender, this number consists of 136 million men and 133 million women. Data Globocon 2020 reveals that breast cancer is the highest among new female cancer cases of all ages in Indonesia, which is equal to 30.8% or 65,858 of the total 213,546 new female cancer cases. Breast cancer is the second leading cause of cancer death after lung cancer in Indonesia. 70% of breast cancer patients have been directed or come to the hospital in advanced stages when the chance of cure and survivorship is lower. Ironically, if breast cancer is found at an early stage, life expectancy will be higher. Breast cancer is the type of cancer most commonly affects women. However, men can also be affected by this disease. Although the proportion is very small, breast cancer in men is generally malignant. The Indonesian Breast Cancer Foundation, or IBCF, was established in 2003, initially named Jakarta Breast Health Foundation. It has been changed its name to IBCF in 2014. It is a non-profit foundation founded by breast cancer survivors, an oncologist, and a volunteer. IBCF has a vision that Indonesia will be free from advanced breast cancer. And its missions are: early detection of breast cancer should be part of the general checkup. Breast cancer early detection services should be done by all hospitals. The outreach of breast cancer awareness to as many communities in Indonesia will be carried out by well-trained health workers and volunteers. Breast cancer survivors can still exist in their respective fields. The main goals of IBCF are: to reduce the incidence of advanced breast cancer, to increase public awareness and knowledge of breast cancer, to find breast cancer at an early stage. The founders of IBCF are Linda Agun Gumelar, Tati A.M. Hendro Priyono, Andi Endriartono Sutarto, Rima Melati Tumbuan, and the late Dr. Sucipto, oncologist. In September 2014, IBCF was accepted as a full member of Reach to Recovery International, or RRI. And in November 2016, IBCF became a full member of the Union of International Cancer Control, or UICC, with a strong and consistent commitment to reducing the incidence of advanced breast cancer in Indonesia. At the commemoration of National Health Day 2020, the IBCF, as a non-profit organization, received an award from the Ministry of Health of the Republic of Indonesia for its consistent efforts in promoting the National Healthy Living Program, or GERMAS, in the category of prevention and control of non-communicable diseases in Indonesia. In order to implement its missions, IBCF has 5 programs, which are: Mobile Mammography Unit, IBCF, in accordance with IBCF's mission, which is to reduce the incidence of advanced stage breast cancer. From 2005 to 2014, IBCF, in cooperation with the National Cancer Center Darmais Hospital, operated the first and only analog system mobile mammography unit in Indonesia in carrying out breast screening for underprivileged women in Jakarta and its vicinities. Since 2015, IBCF has operated a digital system mobile mammography unit. Data from breast mammography screening program through the IBCF mobile mammography unit are as follows. From 2015 to June 2021, the number of women being breast screened are 14,759 women. The number of women with benign tumor are 2,264 women, or 15.3%. The number of women with suspicion of a malignant tumor are 254 women, or 1.7%. Promotion and education about breast screening and breast cancer early detection. As an effort to promote early detection of breast cancer in Indonesia, IBCF collaborates with various women communities in the regions, high schools, universities, print and electronic media, and conducts promotion of early detection of breast cancer to remote areas of the country. Practical training for breast self-examination. Through practical training for breast self-examination, IBCF wants to reach as many people on how to do early detection of breast cancer, which can be done by breast self-examination at home. This training program, which was conducted in 2019, has been participated by 573 participants. The trained participants have now passed on the information about the importance of breast self-examination to various women community groups in their areas. Breast Cancer Peer Support Volunteers Training Program with TÜV Rheinland Certificate. Since 2015, IBCF has conducted Breast Cancer Peer Supports Training Program with TÜV Rheinland Certificate. These breast cancer peer supporters have been given the basic knowledge about breast cancer, how to better communicate with breast cancer patients, and also cultural sensitivity and psychological aspects. Ibcf Shelter. In order to improve its vision and mission, since 2017, the IBCF provided the Ibcf Shelter House for breast cancer outpatients who are members of the National Health Coverage or BPJS Class 3 participants, with a capacity that can accommodate as many as 28 beds for residents. The existence of the Ibcf Shelter greatly helps breast cancer patients undergo continuous medical therapy, such as chemotherapy and radiation, at the cancer hospitals. To further optimize organizational performance, IBCF forms 3 pillars. The pillars of the breast cancer survivors community, consisting of IBCF Breast Cancer Survivor Dian and IBCF Breast Cancer Survivor Kartika. IBCF Peer Support Pillar. Pillar of Breast Cancer Peer Support Volunteers at the Darmais Cancer Hospital. You can be part of the successful completion of all IBCF programs. To donate, please transfer your funds to the following accounts. Let's support IBCF in achieving its vision, Indonesia free of advanced stage of breast cancer. Indonesian Breast Cancer Foundation, saling jaga, saling peduli. Show you care, be aware.